back in November last year, 2018, the Health Board had an absolutely momentous period where it approved its first ever health and care strategy. But that wasn't just a health and care strategy that focused on the provision of clinical services for secondary care, so in hospitals, and also in primary and community care, so out in those communities. It also focused on the long term. And they committed to a transformational shift in the way we deliver those services, with a focus on prevention, the focus on prevention of ill health. So rather than waiting for people to become ill and diagnosing and treating those in high quality services, which is so very important, we also made a commitment to change the mindset, the practice, and also the resources available to support people at a much earlier stage. Well, the health and wellbeing framework was developed to try to support us drive the commitments that we made in the health and care strategy forward. And if I'm going to use one word to sum the health and wellbeing framework up, that's opportunity. Opportunity for the health board, opportunity for every member of staff that works across the health board and how we work better together, and real opportunity for local people to have a say. We're really interested in what matters to local people. We're really interested in knowing actually what matters to them so much, they want to do something about it. And actually really understanding what well-being or a good life, what makes them happy. If we can really try to discover and work with our local communities about those things that matter to them, that will contribute to living well and feeling happy in their lives and being able to contribute, actually we're going to be able to really make a difference in terms of how we shape the services that we offer, particularly in our local communities, to really support that action to happen. I'd been a busy director of public health in a city in the West Midlands, and I could see what was happening in Wales with regards to the well-being of our future generations. I thought this was an amazing thing happening in Wales, where actually in legislation there were some safeguards for our future generations with regards to the environment, having a sustainable environment in which to bring up your children, and also a real consideration of health and well-being in the long term. We need some tools in our toolbox. We need to be able to then turn this vision of what's possible for our future generations into some steps that are tangible and understandable for not just those that work across the health board, but actually how we work better with our partners. Now we have in our framework a wellbeing lens, as we've called it. This wellbeing lens has got 6 questions in it, and each of those questions relate to the 5 ways of working within that piece of legislation I was just talking earlier about, the wellbeing of future generations. Are really important in how we work together in a system. But these questions that we've developed are trying to put a different lens on the conversations that we're having around health and well-being. So using this wellbeing lens to try to tackle some of our problems on a day-to-day basis within health services is one way forward. It also enables different conversations with local people. At the heart of this are our local communities. It's their opportunity as well as ours. This is about us listening to them. This is about not doing to people. This is about doing with people and by people, in terms of them owning the shape of our services that we want to see in our local communities that are going to really make an impact on health. It's really important that we think about the whole system. It's really important that we take these ideas forward in which actually we have a go at creating health rather than just treating illness. I just hope everybody really joins with me and helps me create a movement for change, a change that we so dearly need in this part of Wales, to take our ambitions and real ambitions forward.